Assalamu alaikum dear doctors. In this video I am discussing Dravet syndrome. Another name is velocardiofacial syndrome. First, the other name of Dravet syndrome are 22q11.2 deletion syndrome. Remember 22q11.2 deletion. And another name is Mrcpch syndrome. Mode of inheritance, it is an autosomal dominant condition. Clinical features, easy to remember, catch 2. So patient presents with cardiac defect. There is abnormal face, hooded eyelids, ptosis, hypoplasia of auricles. Thymic hypoplasia, there is T-cell abnormality, cleft palate, parathyroid aplasia, hypoplasia, hypernasal speech, velopharyngeal incompetency, hypotonia in infancy, and learning disabilities and behavioral problems. These are the presenting features of Dravet syndrome. Now, common cardiac defects that associated with Dravet syndromes are interrupted aortic arch, truncus arteriosus, tetralogy of Fallot, and VSD. It is the most common microdeletion syndrome, and there is T-cell disorder. Remember, T-cell disorder is present in Dravet syndrome. Laboratory findings, we find hypocalcemia, low parathyroid hormone, and low immunoglobulin G. Hypocalcemia, remember hypocalcemia, so seizure can be presenting features of Dravet syndrome. Which vaccine should be avoided? Live attenuated vaccine if immunodeficiency. Now there are some question common task exam that baby with cleft palate and other physical signs, what is the genetic association mostly present? So cleft palate and other physical signs that maybe support the diagnosis Dravet syndrome, and answer is 22q11 microdeletions. There are lots of questions come from these topics. These are number 1, low calcium with seizure hypoparathyroidism. What is the diagnosis? That is Dravet syndrome. Another question is that 22 deletion asked what is the other associations? That is parathyroid hypoplasia. Remember in Dravet syndrome there is association with parathyroid hypoplasia. Another question come in task exam that neonate diagnosed antenatally with truncus arteriosus. What else should be excluded after birth? That is parathyroid hypoplasia. Another question that what is the congenital defect in Dravet syndrome? That is third and fourth pharyngeal pouch. Remember third and fourth pharyngeal pouch, this is the congenital defect present in Dravet syndrome. And another question come that neonate with prolonged seizure, calcium was low. What is the investigation that most likely confirm the diagnosis? That is parathyroid hormone PTH. Remember we do parathyroid hormone or serum calcium level in Dravet syndrome. So this is all about Dravet syndrome. Please do subscribe and share my channel. Thank you.